helps figure that out. Now, if the inside of the crest is filled up with the iliacus muscle, then the outside of the crest is going to be filled with muscle too. What muscle group is on the outside? The glutes. So what glutes do we have? Max, medius, minimus. Now, the ones that we can palpate, glute max for sure. That really kind of sculpts, creates the shape of the butt. So where does that originate? Where does maximus originate? Not really. Yep. So glute max is actually going to come more off of the sacrum and come across. So it's not up as high as the crest, but it comes on the sacrum and comes across. There's two main insertion points. One of them is going to be into the femur itself here, and the other major band is going to go into the IT band and then down and assist with abduction. Okay? So glute max comes more here. Now, in knowing that, if you find ASIS and go on the posterior crest, and then you drop in just above, so just drop down below on the inside rim of that posterior crest, there is a ridge. So you can actually palpate the gluteus medius as it kind of sits underneath. Alright, so if you look on this image here, you've got your sideline. So here's your ASIS right there. Right there. So TFL drops down from there. And what we see is glute max really comes off of this line off the sacrum. And it comes forward. But sitting up underneath on this entire posterior crest, all through here and then down through there, is on glute medius. So you can actually easily palpate and get to glute med because it's filling in this top part of the crest. Glute max isn't until you get lower down. Got it? Can we palpate gluteus minimus? No, because it's underneath glute medius, so we can't really get to it. All right? So abduction, glute med, glute max, TFL. Predominantly. Good? Okay. So, next piece. Roll forward. So from back here, we've got quite a few things we can get to. So PSIS is right here, and you've seen like some people have like little back dimples. Okay. So if you feel where that PSIS is, those back dimples are just going to be medial to that. And you can feel. So try that right there. So find your PSIS. Because we're going to find the posterior side of this crest. So what we're doing is, you can see up here that we're finding the medial side of this crest right up through there, and then you can see what all those ligaments are that kind of connect across that SI joint. So if you find that PSIS, and then you step just a little bit in, you'd feel where those divots, those little dimples are going to be. So PSIS is right here. Okay? So if you come in to right in there, you'll feel it drop. Hard. And then it kind of falls in. Right? You guys got it? PSIS. You come in, from there it'll drop just right in there. Now, if the person you're working on has any SI joint pathology, you're pushing pressure right on the SI joint. That person's going to jump, they're not going to be terribly happy with it. Did you guys find it? Okay, so find your PSIS again, which is going to be right there. Okay? So you can find the rim, you feel that crest coming up, and if you come in just from that, you're going to feel it kind of drop off. Got it? So that drop off is the end of the wings where we're getting into the sacrum. So that's your sacroiliac joint, your SI joint, is where that drop off is right there. Okay? So right here.
Just location, just put that back in.
Right there.
You have to like really push
I
through.
know, I can. Strange.
So the sacrum sits right here.
Yeah, that's PSI.
That's the
And then
back end of those plates.
Yeah, just go a little
Falling
bit.
in. So that marks your SI joint.
We probably got a fast mark. Yeah. There you go, right there. It's weird, I can feel exactly where you
All right.
are. You're just comparing it to when he was fine.
So SI joint. What's important about the SI joint? Why do we care? Because I said so, right? No. Why do we care about the SI joint? What's important about the SI joint? Functionally, what is it doing? What is that joint doing for us? What is it? Okay, let's start with SI. It does not stand for Sports Illustrated. So what does SI stand for? So what does it stand for? Sacroiliac. Right. So the sacrum, which is kind of like a triangular fusion of spinal bones, meeting up with the ilium with the pelvis. This is the attachment point of your axial skeleton with the entire lower extremity. So it matters. Right? It matters. It doesn't move much, maybe 1 or 2 degrees. It doesn't move much at all, but if it gets locked at all, that person's going to know. Okay, and then through this region we have an absolute ton of nerves coming out of the lumbar spine and coming down. So your sciatic nerve is going to run down, your femoral nerve is going to wrap around the front and come down. And we'll get back into finding some of those. So external rotation though. The next piece that we need to find are our external rotators. Because most of them are visible from this end. In theory, except they're all completely buried by gluteal muscles, which means that we're not actually going to get them. So, let me put a picture of this up. What are those? How many of them there are? Alright, so blue max, you can hide them out of the way, you can immediately start seeing some of them. As soon as we can drop that out, we've pretty much got access to them. Inferior gemellus, here. Piriformis, here. Quadratus is the rectangular one here. Internal obturator. External is actually going to be on the other side. So superior, inferior gemellus, internal obturator, quadratus femoris, and then piriformis. So this right here, the reason this is the internal external obturator. Ooh, actually. Yeah. So this hole, because you guys have seen how there's like a hole in the pubic the ramus right here, right? That's actually called the obturator foramen. So internal external obturator is referencing which side of that it's covering. So you can see how these come in from the backside attached, and if they pull on that greater trochanter right there, they're pulling it this way, which externally rotates that leg. So they're going from the back and across, and if they fire, they're pulling this back towards it, which externally rotates that leg. Got it? We'll do some manual muscle testing in just a minute so you guys can actually feel some whether it's firing. But again, these things are deep, they're not really palpable, and that makes it difficult to deal with. Piriformis. So piriformis is coming off the sacrum. Most of these others are coming off the pubic rami, or the ischial rami. This arc way down here. So the piriformis is one of the oddballs a little bit because it's coming off the sacrum and down and across. You'll frequently hear of track runners getting piriformis releases done because it's going from here down, like here across, and so you'll get pretty much drop an elbow into that muscle and try to get that muscle to relax. Another major thing, we've talked about your sciatic nerve. a bit. Sciatic nerve comes out about L4 down to about S2, and it's going to go down across this region, and you can see how as it leaves the greater sciatic notch, which is that archway in the pelvis, that it goes in between all of these external rotators. What two major branches makes up your sciatic nerve? What is it going to be called when it splits down here above the knee? So yeah, because it splits here, and one wraps around the head of the fibula, and the other one goes in between the posterior, the superficial posterior compartments. Tibial nerve and what's the other one? Common perineal, right? Or common fibula, either one of those. Okay. Now they're distinct at this level. So a very unique piece that we'll get into in ortho is that it can actually split and go around the piriformis, or part of it can actually pierce through the muscle of the piriformis, which you can imagine might lend that person to have some pathology, because if that muscle, that major nerve is going through a muscle, then it can get irritated fairly easily. So recognizing that exists is helpful. So what we're seeing is this massive structure down through here is our sciatic nerve. So we did flexion, we haven't done extension. Let's do extension. What is hip extension? There you go, right there. Thank you. Hip extension, just lifting that straight leg up, right? So we've got a couple ways to do this. We can do this with hamstrings, we can do this with glutes. And the reason for that is because 3 of your 4 hamstrings start above the hip at what landmark? What is the origination point of most of your hip, the common hip hamstring origination point?
I think you can.
It's this mark right here. Right there. So what bone is that? I mean, your pubic, your pelvic bone is made of 3 bones, right? Iliac crest, the ilium is what we talked about first. Pubis is the most medial internal side of through here. And so what's the third one? Because that's this.
Ischium.
Ischium. So this is, it's the ischial tuberosity. So that mark right there is your ischial tuberosity. So if you find the crease of the butt, pardon me, that right there on the bottom side of it. So right where you get the fold, that's your ischial tuberosity. That would be something to find right now. Okay, so you're going to find, so if you find hamstring, and you're going to come and just push up, you'll find like the bone you sit on when you're in a chair. You think you got it?
I don't want to press hard.
Right. Right there. Right there.
Yeah, so it would be right there.
Yeah.
Okay? And there's a nice solid bone right there. And you've got 3 major tendons coming off of it. So what 3 muscles are coming off of that location? Yeah.
It's like right here, like
Yes.
you just have to. It's like right there. It's like right.
Yeah. Yeah.
You get kind of
She went straight in there.
Yeah. No, you're all right.
So, ischial tuberosity, what 3 muscles come off of it? What muscle group? Hamstrings. What muscles? What 3 hamstring muscles come off of it? Almost. Biceps femoris. Long head, thank you. So, semimembranosus, semitendinosus, and biceps long head come off of that spot. Where does biceps short head come off of? About mid shaft of femur and on down. So biceps femoris is going to come lateral to the LC to the head of the fibula, and then